Good morning, everyone. I welcome you all again on this amazing Sunday with our next session today at our program Panacea. We are really great to inform everyone that today we will be completing 3 months. We started in the month of November, and today will be the last, of course, not the least session for this month. Panacea, as you all know, is a 6-month long campaign which has been conceptualized by Beatrice and eHealth magazine, which is published by Elets Technomedia Private Limited. We have been able to get support from several renowned institutions from across the country and bring a number of experts on this platform to conduct various online sessions on yoga, nutrition, mental health, endocrinology, neurology, and others. Today, we will be conducting 3 sessions, starting with yoga, then neurology, and endocrinology. Today's yoga session shall be conducted by Dr. Rajiv Rajesh, Chief Yoga Officer at Jindal Nature Care Institute, and he has joined us. Welcome, Dr. Rajiv Rajesh. We are not able to hear you, sir. We are not able to hear you, sir. No. At this moment, you are on mute, Dr. Rajesh. Dr. Rajiv Rajesh has been in the field of yoga for more than 2 decades, and presently he is working at Chief Yoga Officer in Jindal Nature Care Institute. And previously, he had worked as a lecturer in the Department of Applied Yogic Sciences in Bihar Yoga Bharati University. So welcome, Dr. Rajiv Rajesh.
Namaskar to you, Harshal. And
Thank you so much.
Can you hear me now?
Yes, sir. We can now hear you. So once again, we welcome Dr. Rajiv Rajesh for the yoga session. You must have learned a lot from the previous session, which have been conducted by Dr. Rajesh. And once again, at this platform, and this very unique platform, and perhaps one of its kind platform, conceptualized by Beatrice and eHealth magazine with support of Jindal Nature Care Institute, Narayana Health, and several other partners, we have been able to bring these sessions to you by these experts. So today, for the very first session on yoga, I would like to hand over this virtual dais, virtual stage to Dr. Rajiv Rajesh.
Thank you, Harshal. I think that you and your team has taken a great initiative. Well, the science of yoga has been there since ages, and the domain of it was a domain of selected people in the past century. Now it has become very popular and is universally practiced by majority of people all around the world, irrespective of their age, belief, and physical condition. It is the science of humanics that works on all levels of our existence: physical, mental, emotional, and spiritual. Thus, it plays a very important role in the prevention of illnesses and in the promotion of health. Asana and pranayama are 2 very important and powerful techniques that develops balance between our body and mind. and thereby it allows the practitioner to enjoy a profound sense of well-being. Beside asana and pranayam, there are certain cleansing or detoxification techniques which have been recommended in yoga to maintain good health. These cleansing or purificatory techniques helps one to detoxify the body by eliminating the toxins from the body. And once the toxins are eliminated, there is a feeling of well-being. So we have talked about some of the cleansing practices in the past. Like I've discussed about one cleansing technique called Jalanithi, in which we clean the nasal passage. You pour the water in one nostril, the water comes out through the other nasal passage, and then it helps to clear the nasal passage. So once the nasal passage is clean, one can breathe properly. Today, I'm going to talk to you about a very important cleansing practice, which is called as Laghu Prachala, which our saints and sages had invented 1,000 years back to clean and purify the stomach and the intestine. The technique involves drinking of lukewarm saline water and performing 5 asana. This helps to clean the entire alimentary tract. You see that there are 3 words, Laghu, Sank, and the third word is Prachalan. The word Prachalan means to clean, to wash. So here we are removing the unwanted things from the system. There is a second word called Sank. Sank means the conch, and it has been used to describe the intestine with their cavernous and the coil structure. And the first word is Laghu. Laghu, it's a shorter version because this means that there is a full version as well. You know. So today I'm going to talk to you about Laghu Prachalan. The practice is done in early morning time on an empty stomach. First thing that you need to know is that you have to prepare the water. And how you have to prepare the water is that you take 6 glasses of water and then you make it lukewarm. You have to keep the temperature about 45 to 46 degrees Celsius. पहले आप 6 ग्लास पानी लेते हैं और 6 ग्लास पानी को आप एक बर्तन में लेते हैं, उसको गर्म करते हैं और इस पानी का तापमान आपको 45 से 46 डिग्री सेल्सियस तक रखना है. देन उसके बाद आप इसमें रॉक सॉल्ट डालते हैं. यू हैव टू पुट 2 टीस्पून ऑफ रॉक सॉल्ट इन द वाटर. 2 चम्मच आप इसमें रॉक सॉल्ट डालने के बाद इसको अच्छी तरह से इसको आप पानी को मिला लेते हैं. ध्यान रखें, इसको हम इस पानी में हमको नमक मिलाना आवश्यक है और वो भी सेंधा नमक, रॉक सॉल्ट का इस्तेमाल इसके लिए करते हैं. So now your water is ready, and you will have to drink the water, and you will perform the 5 asana in a particular sequence. So we will see the demonstration of those practices. एक बार आप देखिए, then we will talk a little more about this practice. So what you have to do is that you have to drink 2 glasses of water. आपको पहले से पानी बना करके रखना है. The ideal position to drink the water is the squatting position, which we call as Padhastasana. So you take the water in the glass, and then you drink the water. आपको पानी जल्दी जल्दी पीना है, एक बार में पीना है. Sitting in Padhastasana, you drink quickly 2 glasses of lukewarm saline water that you have prepared. Now, after you have drank the water, you have to perform 5 asana in a particular sequence. and we are now going to see the demonstration of those practices. The first asana is Tarasana, and we know this practice. We have done this practice previously as well. For Tarasana, you have to keep the feet together, stand erect, look in front at a point, and then you interlock the fingers of the hands. While inhaling, you have to raise the heels and the hands up, turn the palms upward, breathe normally, and then while exhaling, you have to bring the heels and the hands down. सांस लेते हुए हम अपनी एड़ी और दोनों हाथ को ऊपर उठाते हैं, हथेली को ऊपर की तरफ घुमाना है. सांस की प्रक्रिया को हम सामान्य बना लेते हैं. फिर सांस छोड़ते हुए धीरे धीरे हम अपने शरीर को नीचे लाते हैं. इसी तरह इस अभ्यास को 10 बार करना है. सांस लेते हुए एड़ी और हाथ ऊपर, हथेली ऊपर, और सांस छोड़ते हुए हम एड़ी और हाथ को नीचे लाएंगे. I hope that you remember the breathing pattern. Whenever you are lifting the body above the ground or any part of the body above the ground, you have to inhale, and then when you are bringing the body down toward the floor, you have to exhale. तो इस अभ्यास को हम 10 बार करते हैं. दूसरा जो अभ्यास है उसका नाम है तिर्यक ताड़ासन. तिर्यक ताड़ासन के अभ्यास के लिए आपको अपने दोनों पैरों को हल्का सा अलग रखना है. You have to keep the feet about 2 feet apart. The feet will be parallel to each other. Then you interlock the fingers, and then you have to raise the hands above the head, turn the palms up. Now this is the starting position for Tiryak Tarasana. While exhaling, you have to bend laterally toward the right side, and taking care that you're not bending forward or backward. Breathing in, you come back to the center position. While exhaling, you have to bend toward the left side. Breathing in, you have to come back to the center position. तो इसी तरह इस अभ्यास को 5 बार राइट साइड में करना है और 5 बार लेफ्ट साइड में करना है. आप सांस लेते हुए बीच में आते हैं, सांस छोड़ते हुए कमर से बाईं तरफ झुकते हैं, फिर सांस लेते हुए बीच में आते हैं, सांस छोड़ते हुए कमर से दाईं तरफ झुकना है, फिर सांस लेते हुए हम बीच में आएंगे. तो मैंने कहा कि इस ताड़ासन को हम 10 बार करते हैं. इस अभ्यास को हम 5 बार राइट साइड में करेंगे और 5 बार लेफ्ट साइड में करेंगे. इसके बाद तीसरा जो अभ्यास करते हैं उसका नाम है कटी चक्रासन. कटी चक्रासन इज द वेस्ट रोटेशन प्रैक्टिस. For Kati Chakrasan, once again, you have to keep the feet slightly apart. Then you stretch the arms on the sides at the level of the shoulders, keeping the hands straight. Now, this is the starting position for Kati Chakrasan. While exhaling, you turn the upper part of the body toward the right, keeping the left palm over the right shoulder and wrapping the right arm around the trunk. Then looking back on the right side. Breathing in, you turn the body in front. While exhaling, you turn the upper part of the body toward the left side, keeping the right palm on the left shoulder. And then you wrap the left arm around the trunk. And while inhaling, you turn in front. Let us see the side view of this practice. इस अभ्यास को एक बार फिर से देखिए. दोनों हाथ को हम खींच करके रखते हैं कंधे के स्तर पर. लंबी गहरी सांस लेना है. शरीर को दाईं ओर घुमाएं. बाईं हथेली को हम अपने दाएं कंधे पर रखते हैं. दाएं हाथ से पीठ को लपेटना है और हथेली को बाएं कमर पर ले जाना है. पीछे दाईं तरफ देखना है. फिर सांस लेते हुए हम बीच में आते हैं और इसी तरह अभ्यास को हम बाईं तरफ दोहराते हैं. फिर सांस लेते हुए हम बीच में आते हैं। एक बार पीछे से भी इस अभ्यास को देखिए ताकि आपको समझ में आए कि आपको हाथ किस तरह पीठ के पीछे लपेटना है। Raising the arms, stretching the hands straight at the level of the shoulder. Then while exhaling, you have to turn the upper part of the body toward the right side, keeping the left palm over the right shoulder, and then wrapping the right arm around the trunk. While inhaling, you turn the body in front. While exhaling, you turn the body on the other side. Inhaling, you have to turn the body in front, and then while exhaling, you bring the hand down. So we do Kati Chakrasana again 5 times on the right side and 5 times on the left side. Let me once again remind you that you have to practice Tarasana 10 times, Tiryak Tarasana 5 times on the right side and 5 times on the left side. Similarly, you have to perform Kati Chakrasana 5 times toward the right side and 5 times toward the left side. Our fourth practice is Tiryak Bhujangasana. For Tiryak Bhujangasana, you have to lie down in the prone position. यानी आपको इस अभ्यास के लिए पेट के बल पर लेटना है। हम अपने दोनों पैरों को हल्का सा अलग रखते हैं, फैला करके रखते हैं। हथेली को हमें छाती के बगल में रखना है। The feet will be slightly apart, say 1.5 to 2 feet apart. You have to place the palm beside the chest. The chin will be on the ground. While inhaling, you have to raise the head, chest, the navel up. Then while exhaling, you have to turn the head toward the right side and you have to look to the left heel. While inhaling, you have to turn the body in front. While exhaling, you have to bring the chin down. Then फिर से सांस लेते हुए सिर छाती को ऊपर उठाते हैं। सांस छोड़ते हुए बाईं तरफ टर्न करेंगे और दाएं पैर की एड़ी को देखेंगे। सांस लेते हुए फिर सामने की तरफ देखना है। While inhaling, you have to turn the body in front. While exhaling, you have to bring the chin down. Let us see the practice again. सांस लेते हुए सिर, छाती, नाभि ऊपर उठाएंगे। सांस छोड़ते हुए दाईं तरफ सिर को घुमाना है और बाएं पैर की एड़ी को देखना है। फिर सांस लेते हुए सिर को सामने की तरफ घुमाना है और सांस छोड़ते हुए धीरे धीरे ठुड्डी को नीचे लाए। एक बार और देखिए। As you breathe in, you have to raise the head, chest, the navel up. While exhaling, you have to turn the head toward the left side and look to the opposite heel. ध्यान दीजिए, देखना आपको कंधे के ऊपर से है, हाथ के बगल से नहीं। फिर सांस लेते हुए हम बीच में आते हैं। सांस छोड़ते हुए हम धीरे धीरे ठुड्डी को नीचे लाते हैं। तो इस अभ्यास को भी हम 5 बार दाईं तरफ करते हैं और 5 बार बाईं तरफ करते हैं। You have to perform this practice 5 times toward the right side and 5 times toward the left side. The fifth practice is called Udrakarshanasana. For Udrakarshanasana, you have to sit in squatting position. You have to keep the feet slightly apart. Then you hold the knee. You have to place the palm on the knee. You take a deep breath in this position. While exhaling, you lower the left knee and bring it near the right foot. You press the right thigh against the abdomen, and at the same time, you have to turn the upper part of the body toward the right side. Then breathing in, you turn the body in front. सांस छोड़ते हुए अपने दाएं पैर के घुटने को बाएं पैर के तलवे के पास ले जाएंगे। बाएं पैर के जांघ को पेट की तरफ दबाना है। अपने सिर को कंधे को बाईं तरफ घुमाना है। सांस लेते हुए हम बीच में आएंगे While exhaling, you bring the left knee close to the right foot. You press the abdomen with the right thigh and then turn the head and the shoulder toward the right side. Inhaling, you come back to the center position. Then you repeat in a similar way toward the left side. ध्यान दीजिए, बाएं पैर की एड़ी को दाएं दाएं पैर की एड़ी को के घुटने को बाएं पैर के तलवे के पास लेकर जाना है। बाएं पैर के जांघ से पेट को दबाना है और सिर को बाईं तरफ घुमाना है। यानी जो पैर खड़ा है ऊपर की तरफ है उसी और पीछे की तरफ मुड़ना है। सांस लेते हुए बीच में आना है और इसी तरह इस अभ्यास को भी हम 5 बार दाईं तरफ करते हैं और 5 बार इसे दूसरी तरफ दोहराते हैं। You do the practice 5 times on each side. Now, many people nowadays are not able to sit in this position. So we suggest people to do this practice in a modified way by stretching the legs forward. And this is a variation of a practice called Vacrasana, where you bend the right leg. You have to lift the sole slightly above the ground. Then you interlock the fingers and you hold the shin. You take a deep breath. While exhaling, you press your abdomen with the thigh. And then you turn the head and the shoulder back toward the right side. Breathing in, you turn the body in front. Then you release your fingers, stretch the legs. And then you repeat on the left side. बाएं पैर को मोड़ते हैं, हाथ की उंगलियों को आपस में फंसाने के बाद ठीक घुटने के नीचे पैर को पकड़ना है। सांस छोड़ते हुए हम अपने जांघ से पेट को दबाएंगे, कंधे को सिर को पीछे बाईं तरफ घुमाना है, पेट पर दबाव को महसूस करना जरूरी है। फिर सांस लेते हुए सामने की तरफ सिर को घुमाएंगे, हाथों की उंगलियों को अलग करेंगे, फिर पैर को सीधा करेंगे। एक बार और देखिए, पैर आपका तलवा जमीन से हल्का सा ऊपर होना चाहिए। सांस छोड़ते हुए जांघ से पेट को दबाना है, सिर को कंधे को दाईं तरफ टर्न करेंगे, सांस लेते हुए सामने की तरफ सिर घुमाएंगे, पैर को सीधा करना है और फिर इसी तरह अभ्यास को बाईं तरफ करेंगे। तो ये जो अभ्यास है, दिस इज एन ऑल्टरनेटिव प्रैक्टिस for Udrakarshanasana. People who are not able to sit in squatting position, they can do this practice instead of Udrakarshanasana. तो इस अभ्यास को भी 5 बार दाईं तरफ करना है, 5 बार बाईं तरफ करना है। So this completes one round of the practice. You have to repeat the practice in a similar way, the same procedure in a similar way, 2 more rounds. फिर कहने का तात्पर्य यह है कि आपको फिर से 2 ग्लास पानी पीना है और इन अभ्यासों को दोहराना है। जब आप अभ्यास करते हैं तो ध्यान दीजिए, आपको आराम से करना है। जब भी इस अभ्यास को करें, शांति पूर्वक करें, ध्यान से करें, खुली जगह पर करें, जहां आप ठीक से सांस ले सकते हैं, सांस छोड़ सकते हैं। After you have taken the water, you have to perform the 5 asanas. So I said that you have to repeat the same procedure 2 more times. And then you go to the toilet and try to empty the bowel. The movement of the bowel must be in a natural way. That is, when you are passing the bowel, don't try to strain or force. And after you have finished, you will get the urge to empty the bowel. There are some people who immediately feels like emptying the bowel, and there are few who have to wait for some time. Well, this is perfectly all right. Once the pressure has built up the stool and finally all the water that you have drank will be evacuated. So after you have performed this practice, you have to relax in Savasana for about 40 to 45 minutes. During this time, डोंट स्लीप। अभ्यास आपका जब पूरा हो जाए, जब आप 6 ग्लास पानी पी लेते हैं, तब आपको शौचालय जाना पड़ेगा, और जो भी पानी आप पिए हैं वो पूरी तरह से पानी आपका मल के साथ निकल जाता है। अभ्यास समाप्त होने के बाद आपको शवासन में विश्राम करना चाहिए। लगभग 40 से 45 मिनट तक आराम से रहना चाहिए। आपको इस दौरान सोना नहीं है, आपको सिर्फ लेट करके रहना है, शांत भाव से रहना है, यह आवश्यक बात है। कई बार कई व्यक्ति सो जाते हैं, तब वैसी परिस्थिति में आपको आलस्य की अनुभूति होती है या फिर सिर में दर्द भी हो सकता है। After some time, you have to eat a food which is called as khichdi, which is very popular in India, made from moong dal and turmeric. मूंग दाल से बनी हुई खिचड़ी आपको खाना है, जिसमें हल्दी का हम प्रयोग करते हैं। You can add little of cow's ghee, but completely avoid the use of salt and spices. आपको मिर्च या मसाला का प्रयोग इसमें बिल्कुल नहीं करना है। आप इसमें हल्दी डाल सकते हैं। आपको ये मूंग दाल की से बनी हुई खिचड़ी होनी चाहिए। और यह ध्यान देने की बात है कि आपको आराम से खाना है, पूरी तरह से खाना है। खाना खाने के बाद आपको तुरंत पानी नहीं पीना है। लगभग थोड़ी देर के लिए आपको रुकना चाहिए, और 11 बजे के बाद, दिन के 11-12 बजे के बाद आप फिर जिस तरह से दिन में पानी पीते हैं पी सकते हैं, क्योंकि आपने 6 ग्लास पानी पिया है इसीलिए, और वो भी नमक का पानी पिया है, इसीलिए आपको वो जो है अधिक पानी नहीं पीना चाहिए। ये आवश्यक बात है। फिर दूसरी बात है कि ये जिन लोगों को हाई ब्लड प्रेशर की तकलीफ है या हृदय संबंधी रोग है, जिनको कमजोरी लगता हो, अल्सर या हर्निया की शिकायत हो, जिनको किडनी फेलियर की शिकायत हो, चक्कर आने की शिकायत हो, ब्लीडिंग पाइल्स की तकलीफ हो, सीवियर बैक पेन और नी पेन हो, तो उन लोगों को इस अभ्यास को बिल्कुल नहीं करना चाहिए। फीमेल्स को फीमेल मस्ट नॉट डू दिस प्रैक्टिस ड्यूरिंग देयर मंथली साइकिल। मासिक धर्म के दौरान महिलाओं को इस अभ्यास को नहीं करना चाहिए। इवन प्रेगनेंसी के दौरान भी फीमेल्स को इस अभ्यास को नहीं करना चाहिए। बच्चों को और बूढ़ों को भी इस अभ्यास को नहीं करना चाहिए। Take care that you don't take spicy food or synthetic food or processed food or even non-vegetarian food on the day you have performed Laghu Prachala. Acidic food, sweets, chocolates, soft drink, tea, coffee, pickles must be avoided on the day you have done LSP. तो इन बातों का भी ध्यान रखना आवश्यक है। आपको खान पान में बहुत ही परहेज रखना होगा, शांत भाव से करना होगा, तब इसका जो इफेक्ट होता है वो बड़ा ही सकारात्मक प्रभाव शरीर पर पड़ता है। अब सवाल ये उठता है, इस अभ्यास को क्यों करना चाहिए? Why should one do this practice? See, our modern lifestyle has become very hectic and stressful. Our dietary habits have changed. We prefer more of processed and refined food that are low in fibers and high in fat. We don't drink sufficient water. Rather, we prefer to take soft drink, tea, and coffee. The work pressure is so high in the modern time that we don't have time to exercise, and many a time we tend to suppress or ignore the urge to clear the bowel. Now, all these affects the functioning of our digestive organs and also other eliminative organs. And then we suffer from gas and constipation. The stagnant fecal matter builds up as toxins and are absorbed back in the bloodstream, polluting the inner environment and causing auto-intoxication. That is why it has been rightly said, Sarva Roga Mala Vashaya. Constipation is the root cause of all disease. So LSP is a technique that removes the blockages and impurities from your gastrointestinal tract and regulates the function of stomach, small intestine, and colon. It is very effective for people who suffer from constipation and gas problem. Once the bowel has been cleared, there is a feeling of lightness and energy. You get relief from symptoms of toxicity, which helps you bring back your inner harmony and reset the biological clock. किसी व्यक्ति को कब्ज की शिकायत होती है तो बड़ा लेथार्जिक फील करता है, डल फील करता है. अगर आपके शरीर में मल है, आप मल का त्याग नहीं करते हैं, तो कई बार स्किन एलर्जी डेवलप कर सकता है, पाइल्स की तकलीफ हो सकती है, मेंटल कंफ्यूजन हो सकता है, अन्य कोई और तकलीफ हो सकती है. इसीलिए लघु वेट गेन हो सकता है, आपका वजन बढ़ सकता है. इसीलिए आपको लघु संघ प्रक्षालन जो है वो, अगर आपको कब्ज की शिकायत है, यदि आप डिटॉक्स करना चाहते हैं, तो महीने में एक बार आपको इसका अभ्यास अवश्य रूप से करना चाहिए. Well, it is. I can tell you that it is very, very effective in the management of obesity, diabetes, high blood cholesterol, asthma, as well as in occurrence of boils and pimples. Also, it is beneficial for the health of urinary system as it prevents the occurrence of infection. जैसा कि मैंने बतलाया आपको कि इस अभ्यास को आप महीने में एक बार कर सकते हैं. बहुत आपको आराम से इसको करना चाहिए. जिस दिन भी करें, छुट्टी के दिन करें, ताकि आप, और जहां भी करें, आपके निकट शौचालय उपलब्ध होना चाहिए. क्योंकि आपको 6 ग्लास पानी पीने के बाद तुरंत आपको वॉशरूम में जाना पड़ता है, तो शौचालय आपके नजदीक में हो, यह आवश्यक बात है, और खाली रहे, यह भी आवश्यक बात है. जिस दिन करें, शांत भाव से करें. मन को शांत रखते हुए करेंगे तो इसका बड़ा ही सकारात्मक प्रभाव आपके शरीर और मन पर पड़ता है. नेक्स्ट, वी आर going to see another very important practice today, and that is the practice of Surya Namaskar. Surya Namaskar is a very popular practice. It's a combination of 8 postures, and a few are done twice with a total of 12 poses. सूर्य नमस्कार में शरीर की 12 स्थिति होती है और इसमें 8 पोस्चर्स होते हैं. कुछ अभ्यास को हम दोहराते हैं, तो कुल मिलाकर के 12 शरीर की स्थितियां होती हैं. It is practiced in a continuous flowing series. These postures, which are called as Yogasana, are so sequenced that they alternately stretch the spine backward and forward. So first, let us see the demonstration of Surya Namaskar, and then we will talk about this later on. मैंने कहा कि इस सूर्य नमस्कार में 12 स्थितियां होती हैं. पहली स्थिति को प्रणाम आसन कहते हैं. The first position is pranam asana, in which you have to keep the feet together. You stand erect. Then you join the palms together in Namaskar Mudra. That is the prayer pose in front of the chest, and you have to breathe normally in this position. Now, pranam asana develops a sense of balance in your nervous system, and it improves your concentration. Then, while inhaling, you move in position 2, which is called as Hast Uttanasana, where you have to raise the arms up over the head and bend backward from the upper back. You have to keep the legs and arms straight and look up. Now, this practice stretches the arms, chest, and abdomen, and improves the cardiorespiratory and the digestive functions. Dear viewers, I would like you to watch this practice, and then we will do this practice for 2 rounds from the second time. Now, then we move into the third posture, which is called as Padhastasana, where keeping the knees straight while exhaling, you have to bend the body forward from the hips, keeping the palms by the side of the feet on the ground, and then you try to touch the knees with the forehead. Now, Padhastasana stretches the entire spine and the hamstring at the back of the leg. It massages the internal organs and improves the flow of blood toward your brain. Then we move into the fourth pose which is called as Sanchalan Asana, where while inhaling, you move the right leg back as far as possible, keeping the toes and the knees on the ground. You have to push the pelvis forward, bend the spine backward, and raise the head and look up. Now, Sanchalanasana stretches the abdomen and the chest. It is useful for heart and lungs. Also, it improves the flexibility of the spine. Then we move into the fifth pose, which is called as Santulan Asana. So while exhaling, you have to move the left leg back near the right leg. Look in front, keeping the arms and the legs straight. You have to balance the body in slanting position on the toes and the palms. This is the balancing pose, Santulanasana. This pose brings balance in the nervous system and it strengthens the arms and the legs. Then we move into the sixth position, which is called as Ashtang Namaskar. That is, the 8 parts of the body are on the ground. While exhaling, you have to bring the knees, chest, chin on the floor. Slightly, you have to raise the buttocks and the abdomen. The navel will not touch to the ground. Now, this practice strengthens the muscles of your legs, arms, and shoulders. It also helps develop the chest. Then we move into the next position, which is Bhujangasana, which is the 7th position, where while inhaling, you have to raise the head, chest, and the abdomen above the ground. Then you bend the head and spine backward and look up. In this position, the legs will be together and the hands are straight. Bhujangasana makes your spine supple and tones the spinal nerves. It helps improve the function of liver, pancreas, lungs, heart, stomach, and intestine. Then we move into the next position, which is Parvatasan, where while exhaling, you raise the buttocks completely up and then you push the heels down. You have to bring the head between the hands and look toward the navel. Now, this practice makes the nerves and muscles of the arms, legs, and spine strong and flexible. Then you move into the next position, which is Asva Sanchalanasana, where while inhaling, you have to bring the right leg forward in between the palms. You have to keep the left knee on the floor, push your pelvis forward, bend the head and spine back and look up. So this is the repetition of the 4th posture of Surya Namaskar. Again, the benefits are the same. That is, it tones the abdominal organs, elevates the function of respiratory, digestive, and the reproductive organs. Then you move into the next position, which is Padhastasana, which is the same as the 3rd position of Surya Namaskar, where while exhaling, you bring the left leg forward beside the right leg and bend the body forward, keeping the knees straight and try to touch them with the forehead. Now, this pose strengthens the spine and legs, prevents back pain, relieves digestive problems, and removes fat from your abdomen. Then, while inhaling, you have to raise the body and the arms up and bend backward from the upper back. This is Hast Uttanasana, which is similar to the 2nd position of Surya Namaskar. You have to keep the arms straight and look up. Then, while exhaling, you make your spine erect. Bring the palms together in prayer pose, Namaskar Mudra in front of the chest, and you breathe normally in this position. And then you bring the hands down. So this makes one round of the practice. Now let us see the demonstration. Now you have seen the demonstration of the practice. Now let us do the practice for 2 rounds. तो आप सभी लोग खड़े हो जाएं, दोनों पैरों को मिला लीजिए, शरीर को बिल्कुल सीधा रखें, मन को शांत करें हथेली को अपने ठीक हृदय के सामने नमस्कार मुद्रा में जोड़ लें। सांस की स्थिति को सामान्य कर लीजिए। अब आप सांस लेते हुए धीरे धीरे अपने दोनों हाथों को सीधा ऊपर उठाएं, हल्का सा पीछे झुकें, ऊपर की तरफ देखिए, घुटना सीधा रखिए, हाथों को फैलाएं नहीं। सांस छोड़ते हुए कमर से सामने की तरफ झुकिए। अपनी हथेली ठीक पैर के तलवे के बगल में रखें। संभव हो सके तो अपने सिर को घुटने से लगाने का प्रयास करें। फिर सांस लेते हुए अपने दाएं पैर को पीछे ले जाएं, जितना पीछे ले जा सकते हैं। दाएं पैर के घुटने को जमीन पर टिकाएं, सिर को पीछे की तरफ बेंड करें, ऊपर की तरफ देखिए। फिर सांस छोड़ते हुए अपने दूसरे पैर को पीछे ले जाएं और आप संतुलन आसन की स्थिति में चले आएं, जहां आप अपने पूरे शरीर को पैर की उंगलियों पर और हथेली पर संतुलित कर रहे हैं। शरीर बिल्कुल स्लैंटिंग पोजीशन में है। अब आप फिर से सांस छोड़ते हुए अपने घुटनों को, छाती को, ठुड्डी को जमीन पर लाएंगे। नितंब को ऊपर उठाना है, आपकी नाभि जमीन से सटनी नहीं चाहिए। फिर आप अपने नितंब को नीचे करेंगे, यानी आपका पेल्विक पार्ट जो है वो जमीन से स्पर्श करेगा। सांस लेते हुए आपको सिर, छाती, नाभि ऊपर उठाना है। इस अवस्था में दोनों पैर को आपको मिला करके रखना है, हाथ सीधा रखना है। उसके बाद गर्दन को आप पीछे की तरफ झुकाते हैं। फिर धीरे धीरे आप अपने नितंब को ऊपर उठाएंगे, एड़ी को पूरी तरह से नीचे जमीन की तरफ प्रेस करेंगे, सिर को दोनों हाथ के बीच में लाना है और नाभि की तरफ देखना है। सांस लेते हुए दाएं पैर को दोनों हथेली के बीच में हम ले जाएंगे। बाएं पैर के घुटने को हमें जमीन पर टिकाना है, सिर को हम पीछे की तरफ झुकाएंगे, ऊपर की तरफ देखेंगे। फिर हम अपने दूसरे यानी बाएं पैर को दाएं पैर के बगल में लाएंगे, दोनों पैर के घुटने को सीधा करेंगे। सांस छोड़ते हुए सामने झुकना है, सिर को घुटने से लगाने का प्रयास करना है। फिर सांस लेते हुए हम अपने शरीर को और हाथ को ऊपर उठाएंगे, हल्का सा पीछे झुकेंगे, ऊपर की तरफ देखेंगे। सांस छोड़ते हुए पीठ को हम सीधा करेंगे, हथेली को नमस्कार इस मुद्रा की स्थिति में ठीक छाती के सामने जोड़ करके रखेंगे। सांस का ध्यान, और फिर दोनों हाथ को हम नीचे लाएंगे। Let us do the practice once again. You have to keep the feet together, stand straight. Then you join the palms together in front of the heart. You have to breathe normally in this position. As you breathe in, you have to raise both the arms above the head, keeping the hand shoulder width apart, bending slightly backward from the upper spine, and then you have to look up. While exhaling, you have to bend forward. You have to place the palm beside the feet, and then try to touch your knee with the forehead, but don't strain. Bend as much as it is possible. Once your flexibility improves, you will also be able to touch your knees with the forehead. Now, as you breathe in, you have to move the right leg back as far as possible, placing the right knee down on the floor, bending the head backward, looking up. Your left foot should be in between the palms. Then while exhaling, you move the left leg back, then you move in the slanting position. You have to balance the body on the toes and on the palms. Then as you exhale, you have to bring the knees, chest, chin down on the floor, lifting the buttocks so that the navel does not touch to the floor. The 8 parts of the body are on the ground. Then you lower down the buttocks, you bring the pelvic part on the floor. While inhaling, you have to raise the head, chest up, bending the head backward. Take care that your hands are straight, the legs are together. Then you lift the buttocks up. You have to bring the heels on the ground. While exhaling, you bend the head forward and you look toward the navel. Breathing in, you have to bring the leg forward, the right leg forward, the left knee will be on the floor, and then you bend the head backward. Then you bring the left leg beside the right leg. While exhaling, you bend forward and try to touch the knee with the forehead. And then as you inhale, you have to raise your arms and the trunk up, bend slightly backward, looking up. The hands should be shoulder width apart. While exhaling, you have to make your spine erect. Join the palms together in front of the heart, and then you breathe normally in this position. And then you bring the hands by the side of the body. So after you have finished the practice, you must relax in Savasana. अभ्यास समाप्त करने के बाद आपको शवासन में विश्राम करना चाहिए. शवासन के लिए दोनों पैरों को हम हल्का सा अलग रखते हैं. हाथ को शरीर से हल्का सा अलग रखना है. हथेली ऊपर की दिशा में रहेगी. Your head and spine should be in a straight line. Eyes must be closed, and then you relax the body for some time. It is very important that you do the practice with full awareness. आपको अभ्यास को सजगता पूर्वक करना चाहिए, ध्यान से करना चाहिए. कहां पर शरीर के किस भाग पर आप प्रभाव को अनुभव कर रहे हैं, वहां अपने ध्यान को आपको ले जाना चाहिए. I would recommend that you do the practice 3 to 5 rounds as per your ability, as per your capacity. Never strain during the practice. Always do the practice in a neat and clean place. You can do the practice indoor or outdoor, but the environment must be pure. It must be clean. The place must be well ventilated. It's a very, very important practice that helps to stimulate your psychic centers, and it is recommended for people who suffer from obesity, diabetes, hypothyroidism, menstrual disorder, respiratory ailments, constipation, and other digestive disorders. थोड़ी देर इस तरह विश्राम करने के बाद आपको आज मैं एक प्राणायाम सिखलाऊंगा जिसका नाम है नासिका उदर अभ्यास. पर इस अभ्यास को करने से पूर्व पहले देखिए उठना किस तरह से चाहिए. तो पहले आपको दोनों पैरों को मिला करके रखना है, मिलाना है. To bring the legs together, then you raise the arms above the head. Then you have to bend the left leg, and then you turn the body toward the right side. पूरी तरह से दाईं तरफ करवट लेना है. You take the support of the left palm, and then you have to lift the body up. Today, because we have talked about the digestive health, सूर्य नमस्कार का अभ्यास जो है वो भी आपके पाचन की क्रिया को मजबूत बनाता है. हमने लघु संघ प्रक्षालन की चर्चा की, वो भी आपके सिस्टम को क्लीन करता है. तो एक जो अभ्यास जो आपके डाइजेस्टिव सिस्टम के लिए महत्वपूर्ण है वो है वज्रासन का अभ्यास. यदि घुटने में दर्द हो, टखने में दर्द हो, तो इस अभ्यास को नहीं करना चाहिए. कैसे करना चाहिए वो देखिए. You have to bend the right leg, place it under the right buttock. You have to bend the left leg and place it under the left buttock. Your big toes will touch each other. The heels will be apart, and you have to sit in between the heels. This is Vajrasana. Vajrasana stimulates a very important nadi called the Vajra nadi, which is connected to your reproductive organs and to the digestive organs. If you suffer from gas problem, you must adopt a mudra called Vayu Mudra, where you bend the first finger, then you press the index finger with the thumb, keeping the remaining fingers straight, and then you place it on the knees. This is called Vayu Mudra. किसी व्यक्ति को गैस की शिकायत हो, उस व्यक्ति को खाना खाने के बाद इस अवस्था में, इस स्थिति में कम से कम 15 मिनट के लिए बैठना चाहिए। ध्यान दें, यदि आपको घुटने में दर्द तकलीफ है या कटने में तकलीफ है तो आप वज्रासन में नहीं बैठेंगे, परंतु इस मुद्रा को अवश्य लगा सकते हैं। और एक और मुद्रा है जो कि गैस की तकलीफ या कब्ज की शिकायत में रिकमेंड किया जाता है। दिस इज कॉल्ड अपान मुद्रा, where the tip of the thumb touches with the tip of the middle and the ring finger. You have to keep the index finger and the little finger straight, and then you turn the palms up. This is called apan mudra. ये शरीर, this is a mudra which I call the detoxification mudra. ये आप शरीर में से मल को निकालने में मदद करता है। कब्ज की शिकायत हो या यूरिन के फ्लो को इंप्रूव कराने के लिए ये जो है बड़ा ही अच्छा अभ्यास है। कम से कम 15 मिनट के लिए सुबह में और 15 मिनट के लिए शाम में इस अभ्यास को जरूर करना चाहिए। पाचन को इंप्रूव कराने के लिए एक प्राणायाम हम देखेंगे जिसका नाम है नासिका उदर अभ्यास। तो नासिका उदर अभ्यास के लिए आपको सीधा बैठना है। आप पद्मासन में बैठ सकते हैं, अर्ध पद्मासन की अवस्था में बैठ सकते हैं, सुखासन में बैठ सकते हैं, आराम की स्थिति में बैठ सकते हैं, और आप वज्रासन की स्थिति में बैठ सकते हैं। यदि ये सब भी संभव ना हो तो आप आराम से कुर्सी पर बैठिए, पैर को नीचे रख करके बैठिए, लेकिन आपकी पीठ बिल्कुल सीधी होनी चाहिए। अपने बाएं हाथ से आपको चिन्ह मुद्रा बनाना है। चिन्ह मुद्रा के लिए द टिप ऑफ द थंब will touch to the tip of the index finger. Then you have to place the hand on the knee. With the right hand, you have to adopt the Nasika Mudra. You have to bend the first two fingers of the right hand. You have to place the first two fingers at the base of the thumb. You have to keep the little finger and the ring finger together. Then you press the right nostril with the thumb. You have to inhale quickly and forcefully from the left nostril. आपको शक्ति पूर्वक अपने बाएं नाक से सांस को अंदर लेना है। Then you close the left nostril and then you exhale quickly and forcefully through the left nostril by contracting the abdomen inside. फिर आप जल्दी से शक्ति पूर्वक दाएं नाक से सांस को लेंगे, दाएं नाक को बंद करेंगे और बाएं नाक से आपको सांस को छोड़ना है, शक्ति पूर्वक सांस को छोड़ना है। Your inhalation and exhalation will be quick and forceful. तो आपको एक नाक से सांस लेना है, फिर दूसरे नाक से सांस को छोड़ना है। You are inhaling and exhaling quickly and forcefully. So likewise, you have to do the practice 10 to 15 rounds. लगातार इस अभ्यास को 10 से 15 बार करते हैं। The quick and forceful inhalation and exhalation is powered by the movement of the diaphragm. The inhalation and exhalation will be equal in a round and is powered by audible sound. You are expelling the breath forcefully from the lungs with a strong inward thrust of the abdomen. तो इस तरह आपको 10 से 15 बार करना चाहिए और इसके बाद थोड़ी देर विश्राम करना चाहिए, and then you can repeat the practice one or two more times. एक बार जब आप एक नाक से सांस लेते हैं, यानी आप you have started the practice with the left nostril, and then we have exhaled through the right nostril, then we again inhale from the right nostril and we exhale through the left nostril. So this completes one round of the practice. So I said that you can do the practice in continuity for about 10 to 15 rounds. Then you should take a little rest and then you can repeat the practice one more time. Now, this practice helps to bring excess of phlegm from the respiratory passage. It oxygenates the blood, improves the vitality of the organs and the tissues. It is very, very effective practice for people who suffer from constipation, obesity, and respiratory problems. Well, this is also recommended for people who suffer from mm, hypothyroidism and diabetes as well. So I think with this we will end the session. See, Rome was not built in a day. रोम को बनने में समय लगा था. इसी तरह अगर आपको अपने पाचन शक्ति को सुधारना है तो उसमें समय लगेगा. अभ्यास को नियमित रूप से करना होगा. You have to do the practice with regularity. That is very, very important. Thank you very much, viewers. I hope that you continue the practice in your home on regular basis. Thank you and have a good day.
Thank you so much, Doctor, for sharing all these inputs, and it was really a very amazing session today. One question I would like to ask you that we have so many postures and yogasanas, right? How
Right.
should one prepare a schedule, a monthly schedule, to perform all these yoga? Because there are few asanas, for example, the one that you just talked about in the beginning of this session is supposed to be, supposed to be done once in a month, right? Then there are other
Yeah.
asanas.
Well, the technique that we have seen is called Laghu Prachala. It's a practice
Yes.
of, and this involves doing 5 asana.
Yes.
So I would say if you're a beginner, never start with advanced poses. You should start
Right.
with the gentle poses. If you're an old man, then you should start your program with the joints exercise, and you should do those joints exercise. Say ankle bending, ankle rotation, or knee contraction, knee bending, or the practice of butterfly, shoulder rotation, and neck exercise. That is more efficient. My whole idea is to convey the message that do the practice with awareness. ध्यान पूर्वक अभ्यास को करना चाहिए. Don't do it mechanically. आप जो करते हैं उसको समझने का चेष्टा कीजिए. शरीर के किस भाग पर प्रभाव पड़ रहा है ये जानने का प्रयास कीजिए.
Right.
Then after you have learned the joint exercise, then you should move into some basic practices like the practice that we have seen in Laghu Prachala. Tarasana is a very, very effective practice because it creates balance in your nervous system.
Right.
It stretches the whole body. It improves the blood circulation. So you must pick up 4 or 5 practices. Say, in the past, we have seen many of the simple practices. We are yet to see a few of the advanced practices. Generally, I don't show the advanced practices because it can have, once people see those practices, then they try in their home, and then they can then those practices can create injury to the body. So the basic practices, simple practices, do it mindfully. That is the whole idea. If you have to sit pranayam, I would say do anulom vilom pranayam. And if once you have learned the asana, after 2 months, I would say then you should start Surya Namaskar as we have seen today. And there are many postures. If patient wants to know, I can definitely help them. They can write, or they can write to you as well. And if you can send us their difficulties, then we can definitely help them.
Right. So thank you so much. Of course, we are getting queries. We have received queries from many viewers in the past. And once again, I would like to inform everyone that yoga asanas are very effective, and you can start with the simple asanas as Dr. just suggested. But you can always write to us. We will be more than happy to connect you with Jindal Nature Care Institute, and under their supervision and guidance, and as they suggest, you will be able to perform other yoga mudras, which are probably little, require more attention to be performed. So thank you so much. Please write to us. Please get in touch with us. We will be happy to connect with you with Jindal Nature Care Institute. And I once again thank all the viewers for joining us. And thank you so much, Dr. Rajesh, once again for this session. It was really amazing, and we thank you for supporting this initiative from the beginning of the program. Now we have with us another expert joining us today, Dr. Kuldeep Shetty. He is consultant neurology from Narayana Rudalaya Multi Specialty Hospital, Bangalore, and he is going to talk on neurology, how in times of COVID, from a neurology perspective, what all are the things that you need to do, how you should and you can take care of your health and your body and your mind. So, welcome Dr. Kuldeep Shetty to this show, Panacea. We just had a session on yoga, and now this is the second session for this Sunday on neurology. So, I welcome you on behalf of Beatrice and eHealth Magazine to this program called Panacea.
Thank you, sir. Thank you for that kind introduction. So, yeah, today, I'll be covering, I was assigned the topic on Parkinson's disease. So, my specialty being the same. So, I am a movement disorder consultant, a Parkinson's disease specialist at Narayana Rudalaya Hospital. So, just to get an overview. So, what is this Parkinson's disease? So, it's basically to define, it's a neurodegenerative condition. So basically, the cells start slowly being dysfunctional or start getting degenerated, and the cells that are degenerated are mainly involving the nervous system, and they can affect right from the nerves in the gut to the nerves in the brain. So this is how the Parkinson's disease begins. So it's a slowly degenerative process. And one important thing which I want to mention is that not all tremors are Parkinsonian, and not all Parkinsonian syndromes are Parkinson's disease. I was very particular in mentioning this, is that this is the common notion that many times people find that why am I diagnosed with Parkinson's as I don't have tremor, or people with a very mild tremor syndrome come to us looking for whether I have Parkinson's disease. And then the most important point is that, like, not all Parkinsonian syndromes are the same. So there are a huge variety of diseases which are put in a single box called Parkinsonism. So there are, to be very simplistic here, you can divide them into Parkinson's disease and non-Parkinson's disease Parkinsonian syndromes. So I will cover most of my time on this Parkinson's disease, because that's a relatively more prevalent disease, and there are a lot of research going on in this field to various level of therapies. So what are these neurodegenerative diseases? To understand Parkinson's disease, I think it is better to have an overview of how these degenerative disease behave. So neurodegeneration can happen in any part of the nervous system. So we have brain, spinal cord, and the external nerves are called the peripheral nerves, and the nerves which supply the gut and cardiovascular system, they are all called autonomic nervous system. Now, depending on where this slow degenerative process sets in, the manifestations of disease change. So each type of degenerative disease have a peculiar predilection to certain parts of the nervous system. So dementias, these are the degenerative disorders which affect predominantly the cognitive aspect, that is the brain. That is the aspect of the brain which are concerned with planning, with memory, with visuospatial orientation, and similar finer aspects of the brain. So if the degeneration predominantly affects these areas, these present as dementias, for example, the most common of them being Alzheimer's, depending on the same type of degenerative process in some other aspects of the other parts of the brain, you may have a different manifestation. Like for example, the Parkinsonian disorders, they predominantly affect, I'm not saying exclusively, but it predominantly affects the motor aspects of the body, that is related to our locomotion, limb coordination, and all these aspects. When the degeneration affects these part of the nervous system which are concerned with movement, then they manifest as Parkinsonian group of disorders. There are also some other degenerative things in the locomotion. They are called ataxias, but that's a different group. But this is how it is different from the dementia type of disorders. Then you feel if the external nerves are more affected, then they manifest as some other disorders like ALS. So this is the overview. So depending on where the degeneration sets, the manifestation of disease can change. So we will concentrate on Parkinson's disease here. So Parkinson's disease is one of the relatively slow progressive degenerative disorder of locomotion. So it was first diagnosed, but it was first mentioned as a PD by Dr. James from London in 1870. And since then, there has been a huge lot of research on this disease, on its manifestations, and how the disease progresses and how it can be managed at various levels. So how a Parkinson's disease patient presents, what are the early symptoms and what are the symptoms later on in the course of the diseases. So the Parkinson's disease can generally affect they can manifest with two types of symptoms. We classify them as the motor systems and then the symptoms which are not related to motor aspect. So the motor or the symptoms related to movement are very well known, like people they're able to perceive it and they're able to connect well with the disease, because obviously it is very obvious to anyone who is seeing them, or it is obvious to patient themselves. It starts interfering with daily activities. So, and then there are a whole group of symptoms called non-motor symptoms, and they may be present even before the motor symptoms begin. Even you may have symptoms of Parkinson's disease even before the tremor or the slowness sets in. So these are called the non-motor symptoms. The issue is that these are less recognized, or people don't recognize that it is connected to ED. There is a need to have some awareness regarding this. So coming to the symptoms related to the movement. So the most cardinal symptoms of Parkinson's disease are tremors, and then the slowness, and then the stiffness of the limbs. The tremors are usually seen when the patient is at rest or the patient is holding something. So, and usually starts with one side of the body. For unknown reason, it has a predilection to affect one side of the body more than the other. So this is very classic for Parkinson's disease. And some symptoms begin in both sides, we doubt whether if it is Parkinson's or not. So it's very characteristic that symptoms begin in the one side of the body initially, and later it progresses to the other side. So the patient usually present with symptoms called tremor at rest. So when the patient is taking rest or sitting idly, then the patient finds that there are tremors. Many patients may not manifest tremors. They may just find it that they have some slowness in one of the arms, the other arm, it's not as fast as the other arm, or they may start feeling some stiffness in the shoulder, and some stiffness is one arm, which is not there in the other arm. So it may just start like that. The symptom onsets are very slow, and it's very, very common that patient initially visit some other specialty thinking that it's a joint pain or something like that, and there many times there is a delay in uh, consulting the doctors by at least around 1 to 2 years. That is very common, unless the patient has tremors. So patient with tremors seek treatment early because it is very obvious and they know that it is something in the nervous system. But the patient who don't have tremors, sometimes there is a delay in reaching the doctors. So because of the very slow nature of this disease and very subtle manifestations to begin with, subsequently it becomes very obvious and patient realize that they clearly have a problem on one side of the body more than the other, and then they approach the doctors. So these are the motor symptoms which I said. Then this other group which requires more attention, and of late there are a lot of research on these topics, they are the non-motor symptoms. So Parkinson's disease, as I told, it affects different parts of the nervous system. It has a predilection to affect the movement part of the body, but it also involves many other nervous uh, parts of the nervous system. For example, the one of the commonest manifestations of Parkinson's disease is that they complain of decrease in the smell sense, and this can predate the illness even up to around 10 years. Like patient may be having a decreased smell sense for 10 years before the onset of tremors. So this is a very common finding in Parkinson's disease patients. So it can affect different parts of the nervous system. Like you can have issues with smell sense. There can be issues with the sleep. So the patient with Parkinson's may have some symptoms in sleep wherein they throw their limbs, they just speak out in dreams, or they act out their dreams, and sometimes patients fall from the bed without their knowledge, and this is not recognized for many years, and because the motor symptoms have not begun. So in isolation, it is difficult to diagnose. People think that this is something, patient is anxious, so that's why they might have fallen, or that's how these are missed in the initial stages. Then, apart from that, patient may have sleep insomnia. There can be issues with the mood like depression, anxiety. There can be some issues with the blood pressure fluctuations, that is tendency to have some low blood pressure on standing. And then there can be subtle urinary disturbances. And so these are the symptoms which are called the non-motor symptoms. So these form a huge chunk of symptoms in a given patient of Parkinson's disease, and it is important for us clinicians to address these aspects also when we are treating the movement-related symptoms. So there need to be awareness about these symptoms in a patient of Parkinson's disease. They sometimes help us in making an early diagnosis of Parkinson's disease, which will help us to educate the patient better and plan the future therapies in these patients. So what is the age of onset when the Parkinson's disease begins? Of course, it is very commonly known as the disease of the elderly, but more than 20%, roughly around 20% of the patients of Parkinson's disease are below 40 to 50 years of age. So they are called as young onset Parkinson's disease. So this is one thing which is needs awareness. So Parkinson's disease is not just a disease of elderly, it is more common, but it can definitely affect the youngsters as well. And what is the course of this disease? So Parkinson's disease is a relatively slowly progressive disorder. So the symptoms progress in terms of years, and doesn't affect much of the balance part, and most of the patients are able to carry on their works and are able to be independent for a significant period of time. Of course, with they need the assistance of the medical therapies, but with the therapy, they're able to carry on their activities of daily living the profession for a significant period of time. In short, to say it is a slowly progressive and disorder, and it can be managed significantly satisfactorily with the currently available therapies. So, so how do we manage this disorder? So, so I'll be speaking from the allopathic perspective. So, is there a need to a very early identification of this disease? Like, for example, I told just now that sometimes a patient may be having some symptoms which are not related to movement. Like, for example, a patient may have a sleep shouting in dreams, or they may throw their hands or limbs in dreams, and they may have some lack of smell, and they still don't have motor syndrome. So is it important to pick these patients at this stage? Precisely, it is no, because a slight delay in initiation of the currently available medications for Parkinson's disease doesn't affect the course of the illness. That is because the treatments which are available for the Parkinson's disease as of now, they mainly target the symptoms rather than the root cause of the disease. The root cause of the disease in all these degenerative disorders are still like largely unknown. The maximum research are going on in these fields to find what is the root cause, and are there any disease modifying therapies like which target this root cause of this illness and modify the disease. These are still under at research levels, and there is such therapies are not available at our clinical practice. So there is no need to panic that I got diagnosed 2 years down the line. I had tremors 2 years back. I missed the therapy. No, precisely that is not the case. So generally, the therapies are purely directed towards the level of comfort the patient wants. So a little residual symptoms despite treatment is acceptable as long as it does not disabling the patient. So there are a lot of varieties of medications which we prescribe for Parkinson's disease. And the good thing about Parkinson's disease that they respond very well to the medications. And most of the patients have a very, very high level of satisfactory response to medication. They almost feel normal with the medications, and most of the medications are very well tolerated. They don't have any interactions, significant interactions with most of the other common disease medications like diabetes, hypertension, so they can be easily taken. This is what most of the patients question, like since the elderly are the major patients who have this disease, so they are always saying that I'm already on medications, 10 medications for diabetes, hypertension, coronary artery disease. So you're adding one more set of medications. So generally, they don't have much issues with. You can take them with along with these medications. There are no much issues. So how long is the response? That is the another important question in a patient's mind. Generally, Parkinson's, the response to medication will be there throughout their illness. Patient will have response to the medications, and that is the most characteristic feature of this disease. If a patient of Parkinson's disease doesn't show any response to medicine, then we doubt the diagnosis. So patient should have, but there can be there will be some waning of the effect as the time progresses. So that is where we offer the advanced therapies. So there are few advanced therapies for Parkinson's disease patients, which most of them require around the time they complete 1 decade of the illness, or around 8 to 10 years of the illness. There are patients who do very well with medicine even into the 2nd decade of the illness without any need for advanced therapies. But the majority of the patients at around 8 to 10 years of the illness, they are candidates for advanced therapies. So the therapies which the advanced therapies, these include mainly as of now currently in India we have two advanced therapies which are called deep brain stimulation, and the second one is called the apomorphine injections. So these are the advanced therapies which are like they act as a supplementary to the ongoing medications. So they're not like it's not that the medication will be stopped and the patient go to the advanced therapy. So they will work in tandem with medications. So these advanced therapies and along with the medications, they give a relatively a good quality of life to the patient than medications alone. So that will help in further augmenting the quality of life when the patient starts showing that the medications alone are not enough. So the deep brain stimulation is, to be very brief, it is electrical stimulation of the part of the brain which are concerned with the movements and which are pathological in Parkinson's disease, and a minor electrical stimulation of those areas, continuous stimulation through a battery placed, they give a benefit in the symptoms which almost mimic the benefit they get with the medications. So to be very precise, this is what is called the deep brain stimulation. It's a surgically placed on the target, and then through a battery there will be continuous stimulation of the electrical current to the battery, and the patient will be the apparatus is not seen because everything is under the skin, and the wires all are placed under the skin. The battery is placed on the chest, and the lead, two small leads will be placed in the deeper part of the brain. So this is another additional therapy which is offered for patients with Parkinson's disease who are wearing off of benefit with medications. So in together, so the symptomatic benefit which a Parkinson's disease patients gets is significant, and they can lead a fairly good quality of life provided they take these therapies, and they can lead a productive life for a significant number of years. So then coming to the what is the natural course of this illness like, and compared to other disorders. So as I told, Parkinson's disease is a single disease, and other Parkinsonian disorders are put into another box. So they have to be. It is important to know that Parkinson's disease and Parkinson plus disorders, because the prognosis and the management is totally different when we compare these two groups. So the Parkinson's disease has a fairly milder course, whereas the Parkinson plus group of disorders are relatively fast progressing type of diseases, and they do not have the options of advanced therapy. Their response to medications are moderate, and most of them require physical therapies like physical assistance, rehabilitation. Those are the mainstay of care of this group of patients. So what then coming to the cause of the illness. So why? This is one question which most of our patients ask us with the moment we diagnose them as probably that you are having a early Parkinson's disease, especially the youngsters. So the root cause of this illness is still not known. There are no specific risk factors for Parkinson's disease till date. There's nothing like a single factor which affects Parkinson's disease other than the age. Age is one of the strongest risk factors for Parkinson's disease. But we know that 20% of them are youngsters. So there's no, it's a, in brief, it is a multifactorial disease, and the exact root cause is not known. So it is no way, it is not related to any specific bad habits or any specific type of exposures or any specific geographical location, or I said that in around 5 to 10% of the patients there is a family history that there is some person in the family who might be having it. But when majority of the cases it is not genetic, at least as of as till date, it is not genetic to the level of research which has been conducted till now. So majority of the Parkinson patients are what we call as sporadic, that is just and sporadic and idiopathic, we call it. So that means that the root cause, there's no specific root cause and there is no specific familial trait. So it just affects some, it's a spontaneous degeneration which begins in the person, and slowly it starts affecting the various nervous system. So, so hence, so there is no specific, that's the reason why they have not been able to devise any specific disease modifying therapy, because of its multifactorial nature. So there are no, although there are a lot of research which are going on to find the disease modifying therapies. So what about the care, non-medical type of care in a Parkinson's disease patient, as far as lifestyle or diet or anything like that are concerned? So generally, there is no specific, as far as the allopathic stream is concerned, there is no specific recommendations to diet. Of course, a healthy, balanced diet is important for the overall well-being of any person. So the same type of uh, diet has to be followed, and there is no specific major dietary modification required while the patient is on medications. There are a lot of research on exercise in Parkinson's disease, and the common, the bottom line is that physical exercise is very helpful, and all patients of Parkinson's disease are encouraged to do physical exercise, and which involves mainly aerobic type of exercises. So the simplest way is walking, or any form of other aerobic exercise will do. So generally, exercise is helpful for these patients to both in terms of uh, slower rate of progression of the disease and also for the overall well-being. So we recommend regular exercises and healthy, balanced diet in these patients. And what should a patient know in mind when they are diagnosed with Parkinsonism? So one thing is, it is important to get a diagnostic label as far as the disease is concerned. The first thing you should know is that what type of disease should I suffer, am I suffering from, whether it's a tremor disorder, whether it's a Parkinson's disease, or it's a Parkinson plus type of disease. Initially, in the first couple or 3 years of the illness, sometimes it is very difficult for the clinician to differentiate, because the disease hasn't evolved enough to be able to categorize the disease as this group or that group. But around, at least by around 3 years or 4 years into the illness, a clinician will be having a fair idea about what type of disease this is, and he'll be able to classify the disease as a Parkinson's disease, or a Parkinson plus type of disease, or it's just a tremor, like essential tremor disease. So it is important to reach the diagnostic level at as early as possible, so that we can educate the patient on what type of it helps us to prognosticate the illness, and also help the patient in taking decisions about future therapies, and also planning for the future therapies. So that's one of the important aspects which the patient should know. So who are the people to approach when you are suffering from such type of symptoms? So basically, the important things to note are tremors or any slowness, or any stiffness in the limbs, and any symptoms like lack of smell associated with these type of symptoms, or any abnormal sleep behaviors. So these are the things which should alert you that something's wrong, and consult a neurologist, or if available, there are doctors who are specifically uh, interested in these type of disorders, and they are called the movement disorder or Parkinson's disorder specialists. So you can consult any of them, and it will be easy for them to diagnose Parkinson's disease on the based on the set of symptoms. The generally the diagnosis of these type of disorders are made largely on the clinical symptoms of the patient rather than any investigations. So Parkinson disease is one group of disorders in which the clinician's role is paramount, and we will not be able to make a confirmed diagnosis just on the basis of a scan or anything. It is largely a clinical diagnosis which the clinician will be able to do after a careful history taking and a careful examination, and the role of any investigation is only supplementary in these cases, and it is not a diagnostic thing in uh, in this type of neurological disorder. Unlike there are diseases which are diagnosed with scans, but Parkinson is one group which are diagnosed with history and clinical symptoms. So this is my overall brief review about Parkinson's disease, and a brief view of how the disease behaves, and how the disease progresses, and how it is managed, and what are the points to look for in the illness, what are the early signs, and any lifestyle changes which we have to make as far as this disease is concerned, and whom to approach who can help you in handling these disorders. So I would like to conclude my session with this. Thank you.
Thank you so much, Dr. Kuldeep Shetty.
Thank you.
There are a couple of questions that we would like to ask you. Uh, the first thing that I want to ask you is that are people suffering with Parkinson disease, are they at greater risk of developing COVID-19? Is it true?
Yeah. So yes, sir. So yeah, sorry for not specifically mentioning about COVID. Yeah. So generally, Parkinson's disease per se doesn't much affect the immunity of the body. It's a disease which is largely affecting the nervous system. But Parkinson's disease, as I told, there are various stages. So the more later you are in the disease, so the morbidity associated with the disease is more. So just like any other patient who are relatively morbid, so that is the end stage or advanced Parkinson's disease patient, I can say, are slightly under more risk. Rather than having more risk of having getting Parkinson's disease, I would say that they will be under more risk for say morbidity or mortality or hospitalization if they get the COVID. So that is the reason to know that how to protect these patients from getting COVID infection. And there are no just to cover on the point of vaccination point of view. Of course, the guidelines for vaccination as of now is not very clear as far as people suffering from diseases is concerned. So but the general overall guideline is that in patients who are very critically ill, they better be left out for the initial thing. As time progresses, we'll learn about how these patients behave to the vaccine. But otherwise, a general patient who is doing well and who is not having very severe symptoms and who is otherwise very well maintained on medications, I think there is no contraindication for the vaccination. Hello?
Okay. Someone,
Yes.
someone in fact has asked this same question over the WhatsApp that should people suffering from Parkinson disease go for the vaccination?
I think, yeah. So exactly. So they need to know what stage it is and how severe. What is the basically the point is that the there will be sometimes there will be expected level of immune reaction to the vaccine. So whether the patient can take it or not, they are in a health state to take it or not. That is the only question. So it is better to meet a neurologist and get a overall assessment of the disease state. And if the disease is very well symptomatically controlled, I think it is not a contraindication.
Okay, one more question. Again, someone
Yes, sir.
has asked that I have Parkinson disease. Should I be venturing out for activities such as exercise classes, and I can live normally outside my home?
Definitely, definitely. Physical exercise, as I mentioned, is very important. So that is, there are a lot of scientific studies on physical exercises and Parkinson's disease. They are known to help in a slower rate of progression of the disease. And definitely they should be able to venture out and do all their activities, and they should lead a normal life as long as the disease has been very well controlled with medications. They should be able to do that. There is no
Right,
contraindication.
right. Right. Thank you, sir. Thank you so much. With this, we formally would like to close this particular session here. And would like to thank Dr. Kuldeep Shetty from Narayana Rudalaya, Bangalore, for joining us and conducting this session online. Once again, would like to inform all the audience, if you do have any question, please write to us. We will be happy to connect you with Dr. Kuldeep Shetty directly, and you can further get in touch with him if you have got any query and if you want to ask him something very specific. So thank you so much, Dr. Kuldeep Shetty. This was
Thank
the
you.
second session on neurology. Now we will be joining here by Dr. Ridish Narayan Chakravarti. I believe, yes. So Dr. Chakravarti has already joined us, and he is consultant endocrinologist, Narayana Super Specialty and Multi Specialty Hospital, Ravindranath Tagore International Institute of Cardiac Sciences, and Medica Super Specialty Hospital, Kolkata. Thank you so much, Dr. Chakravarti, for joining us.
Thank you, Harshal. So I'm audible and visible both.
Yes, sir. It's perfectly fine. We can hear you, and we can see you as well on the camera. So, Dr. Chakravarti, just for your information, we had two sessions. First
Yeah.
one was on yoga, and
Yeah.
second one was just we finished with Dr. Shetty. Again, he's from Narayana, who conducted a session on neurology and talked about Parkinson disease and risk
I was there
associated.
in both as the audience, so I heard both of them.
Thank you so much, sir. We have about 1,500 people joining us live at this moment on Facebook. And now I would like to hand over this virtual dais to you, Dr. Chakravarti, who is going to conduct the session on endocrinology during COVID-19. So, with this, I hand over this virtual mic and virtual dais to you, Dr. Chakravarti.
Thank you. Let me start with sharing the screen, and you just confirm me whether everything is going right.
Yes, yes, yes. Please, please do.
Is everything going right?
Yes, we can see this presentation, endocrine and metabolic aspect of the COVID-19 pandemic.
So with we start the session without any
Sure,
further.
of course. We are already live, sir. We can start the session now.
Yeah. So thank you for giving me an opportunity to speak at this podium, though it's virtual, and for those nice and kind words of introduction about me. I must thank my two previous speakers, Dr. Rajesh and Dr. Shetty. They were excellent sessions on yoga and neurology, respectively. And my job here is to take you through a gentle breeze, which will talk about the endocrine and metabolic aspects during this COVID-19 pandemic. So, obviously, we are now 1 year down the lane dealing with this hazard, which is rocking the world. and we are almost at the verge of appearing at a conclusion, but still we are far away. We have new scientific evidences coming up almost every other day to tell us how the endocrine aspect is being affected by this COVID-19 pandemic. So let me just tell you at the beginning of this discussion that whatever I'm speaking today is actually what we know till this date, because new scientific evidences will come up every moment and we have to update our knowledge accordingly. So whatever I'm saying is actually, you can say, true as on today. Now, let us start with the statistics because this bothers us always. So, till now, we have about 10 million cases. I have taken this data on January 30, afternoon time, and we have about 1.5 lakh deaths, and the recovery rate has been quite good. And thankfully, with God's grace, we can say, compared to the Western nations, maybe our country did not face the wrath of so much mortality, so much affection as in other countries, though we as a developing country, so-called poor country with a high density of population, would have been affected more expectedly if we go by mathematical models. But thankfully, with God's grace, that did not happen. Now, if you look at this curve, this is very important. We started 1 year back in this pandemic. And if you look at the new cases, there has been a bell-shaped curve. We had a very high peak in September. We are having about 1 lakh cases per day, almost 1 lakh cases per day. And now, if you take the statistics on end of January, we're about hovering around 13,000 cases per day. If you look at the deaths also, that has also been reflected in this smooth bell-shaped curve, where we are having about less than 150 deaths per day. Now, why this statistics is important at the very beginning of an endocrine discussion? It's important for two reasons. Number one, we should understand the depth of the problem, and simultaneously we should be prepared for what is going to come, and we should be prepared to face the problem rather than getting afraid of the circumstances. Now, in the flow of this presentation, I would just begin with a small introduction, as I've already given, and we'll talk of several diseases which concern me as an endocrinologist, and most importantly in the society. That is, of course, the problem of blood sugar, that is diabetes mellitus. The second will be of obesity, where the patient puts on a lot of extra weight. The issue of vitamin D, the fats, the pituitary gland, the thyroid gland, the calcium status, and finally, what we look forward to in the near future research. Now, COVID 19 has tremendously impacted our day to day life. Obviously, we have changed ourselves a lot. We have stopped talking to people, we have stopped meeting people directly, we are doing everything virtually. Even this program actually shows how we are meeting virtually instead of meeting on a desk. Now, virtually all organs and biological systems suffer from this new coronavirus infection, either because the virus directly targets that tissue or because of the indirect effects. Now, endocrine diseases are not an exception, and some of the endocrine organs are at risk of direct or indirect onslaught by this virus. So, although there is still no evidence of higher predisposition to contract the infection in patients with diabetes and obesity, the coexistence of these conditions contributes to a worse prognosis because both the conditions affect with the impaired immunologic system. If your body doesn't have that thing to fight the organisms attacking you, then you are obviously in a soup. So diabetes is obviously a condition where this circumstance already exists. Over and above that, you are being attacked by the virus. So these make actually a very bad combination. Now, we have all heard from the media, we have heard from doctors that cytokine storm, which we tell, it's very bad thing when it occurs. It doesn't occur in everybody, but obviously when it occurs, this is actually responsible for the multi-system failure and the mortality, that means death in patients with COVID-19. Now, glycemic control, which means obviously proper sugar control. This has been demonstrated to be crucial to avoid long hospital stays. So, how long the patient is going to stay in the hospital is somehow guided by many factors, but one of them is definitely how better was the sugar control of the patient. Also, the ICU requirement, because some patients require only ward management, they remain in the general wards, while some have to be shifted to ICUs because there are some emergencies or multi-organ failures which require external support. So which patient will require ICU support? That also is guided by various factors, one of them being obviously the sugar control. And also, lastly, prevention of excessive mortality. That means how many people are prone to die from this infection. That also is guided by many factors, out of which sugar control is definitely an important one. Now, what does this endocrinology is all about? It is all about hormonal organs. If we start from the top, we can talk of the pituitary gland, which is inside our brain, inside our cranium or the skull. If we come down in the neck, we have the thyroid gland. The fat itself, the subcutaneous fat which we have below our skin, and the fats in other organs, regions of the body, that also is an endocrine organ or hormonal organ. Then obviously we have the pancreas in the abdomen. What is that? This deals with diabetes, because the pancreas produces insulin. If the insulin does not gets produced properly or cannot act properly, we have various types of diabetes. Then adrenal gland, which is just a small gland situated on the top of the kidney like a cap, that is also very important for our existence and survival on this planet, because they produce steroids, and steroids are very important for survival. Though by the word steroids, a common man will understand a medicine which is very dangerous, which is given in very exceptional circumstances by the doctors. But we all have steroids in our body, which is synthesized from this gland, and this is very much important for survival. Then we have, in males, we have testicles, in females, we have ovaries, and of course, bone. These are all endocrine organs. Now, virtually every organ system can be affected by COVID-19. That is the beauty or the problem with the disease, that it is such a small virus, but it has the potential or propensity to affect many organ systems of the body. If we talk of diabetes, we will start with that because it's the commonest endocrine disorder which we have in the society. Now, if you look at the International Diabetic Federation, what they have said, that India is one of the 7 countries of the IDF Southeastern Asian region. 463 million people have diabetes in the world totally, and out of them 88 million people live in the Southeast Asian region. And do you know how much we have in our country? It is close to 77 million. And I'm quoting a data from March 2020. So we have moved 1 year ahead. And obviously, and unfortunately, the number has definitely increased. So out of 463 million worldwide, out of 88 million totally in the Southeast region, only India is contributing 77 million people. So huge burden of the disease we have in the society. So you can see the statistics that 8.9%. What does this mean? That is, out of 100 people, almost 9 people have diabetes. Or in short, almost 1 person in every 10. So if you count 10 people around you, you will find at least one person who has diabetes. Now, just to recap for everybody, is that there are various types of diabetes, but the diabetes that we see mostly in the society is type 2 diabetes. And this usually occurs not in children, but slightly after some ages, say after 15, 20 or like that, though we have early onset type 2 diabetes. This actually means that in the initial part, the patient might be well controlled on medicines, but in the later part might require insulin. But type 1 diabetes is different. This is usually occurring in children. This we call as an autoimmune disorder, where some other organ systems are maybe simultaneously affected, like thyroid, adrenals, etc. And in type 1 diabetes, which occurs in children, as I was mentioning, that requires insulin from the very beginning for survival. So the patient cannot survive without insulin. So that's a different entity, and that occupies only 7% of the total cases we have. But 90%, that means out of 100 diabetic patients in India, almost 90 will have type 2 diabetes. Now, how COVID-19 is related to diabetes mellitus? What we need to understand is that individuals with diabetes may be at increased risk of infections, especially we know influenza, pneumonia, etc. So diabetic people are already one step ahead in catching infections because their immunity is disturbed. So all people with diabetes, we often recommend like pneumococcal vaccines, then annual influenza vaccines. So this actually establishes that diabetic patients definitely have increased tendency to catch respiratory infections. And in general, it is assumed that this risk can be reduced, though not completely eliminated, through proper sugar control. So imagine a situation where there is one patient who does not have blood sugar high, another patient who has diabetes and has good sugar control. He follows the instructions of the doctor, he takes medicines, he follows good lifestyle, does yoga and all those things that keeps him happy, satisfied. There is a control over his diet. And a third category of patient who is diabetic, but the sugars due to some reasons are not well controlled. So in among these three patients, obviously the most fortunate regarding infections will be the person who does not have diabetes. But what about the other two who have diabetes, one having high sugars and one having controlled sugars? Obviously, the lesser evil, the lesser problem will be with the patient who has good sugar control. So obviously, our message through all these programs should be that if you have diabetes, your target should be to have a good sugar control so that your tendency to catch infections can be as low as possible, though it cannot be completely eliminated, but still it can be close to those persons who do not have diabetes. Now, data about the occurrence of COVID-19 in patients with diabetes are limited at present, but are increasing steadily every week because new data are pouring in almost every week. So we are just compiling them and trying to find out how the relation is between the two diseases. Though recent studies have shown that present pandemic does not seem to account for a much higher capacity to infect people with diabetes. This is important. But once they get affected, the outcome may be decided by many factors, out of which one may be how the sugar control was. Now, if you look at the various countries which were affected, like talk of China, USA, then the European countries of Spain and Italy, what we need to understand, how is the prevalence of diabetes in the hospitalized patients as well as general patients in different countries. You can see the graphs. So in China, you can see that the blue color means hospitalized patients and the orange is depicting the general population. So uniformly, you can see that diabetic population is quite big in those, both in the general population as well as the hospitalized population in almost all countries. So diabetes definitely is coming up is a very important common link in this disease. Now, people with diabetes do face a higher chance of experiencing serious complications. This is important because we know that many patients of COVID will be asymptomatic. They don't even know that they are having COVID, and some patients will have only some small symptoms like only a sore throat, little bit of fever, and then they recover without any complications. But there are some people which we know that who are moving to ICU, who are having respiratory problems, shortness of breath, breathless, getting breathless. There is lung fibrosis, there is myocarditis, that means the heart is getting damaged, the kidney is getting damaged. So who are those category of patients? If we try to find out, then people with diabetes obviously are those people who are a large chunk in those who are having complications. So this thing has to be driven home properly. The diabetic population have to be extra careful. They have to bring down their sugars quite well. They have to visit their doctors and keep their everything in check. They should have a good lifestyle and they should obviously try to remain de-stressed, not distressed. It is de-stressed and happy. Now, why is sugar control so much important? Why am I always repeating the same thing over and over again? This is because if the sugars are elevated, it actually disturbs the body's immune response to fight the virus. So as a consequence, patients with diabetes have a higher viral load as well as much severe disease. So obviously, if the sugars are high, then the body cannot fight well and the viral load will be very much high, and so complications can be expected to be high. It is anticipated that sugar control, good sugar control, can have beneficial effects in patients with coexistent diabetes and viral respiratory diseases such as COVID-19. We have all heard of all these tests which are being done, like D dimers are tested, interleukin 6 are tested. These are more elevated, these are high in patients who do not have good sugar control. Now, both patients with high sugars, not previously having diabetes, and patients with existing diabetes have a higher risk of severe disease than those without diabetes. So whether you have a sugar for large number of years previously or you are now having sugar recently, that is not having much impact. The impact is basically between whether you are having blood sugars high or not having blood sugars high. So that thing has become very important. So this emphasizes the importance of early detection of blood sugars. So obviously we do a lot of tests and find out, because we find many patients now who were earlier non-diabetic, suddenly the patient has turn diabetic. So in those patients, maybe bringing down the sugars by good lifestyle, good diet, and obviously if medicines are required, so that has to be followed. And we know of a complication in diabetes, which is called diabetic ketoacidosis. Is a very serious complication, and it requires hospital management. So this is particularly hazardous to treat in patients who are also having coexisting COVID-19. Now, how do we actually take into account the treatment for people with diabetes infected by COVID-19? What we need to understand that as far as from allopathic perspective, we give lot of medicines. Like we have different classes of medicines which are given orally. That means the patient has to take in the form of tablets, and some are obviously injectables. Like for example, we will talk of insulin. So which is good for you at that particular moment, that definitely has to be decided by the doctor, because some medicines might need to be changed. This part is important because certain medicines may not be good to continue when the patient is getting hospitalized, is having some complications. So this part definitely is taken care of healthcare professionals. But thing to be remembered is that follow the advice which is given from time to time by your healthcare professional, and also follow the local guidelines given by the government. Coming next to obesity, this is very important because obesity is an ever increasing problem in Indian population now. Earlier, we used to have a traditional lifestyle, good Indian diet. That is gradually shifting. We are becoming more westernized, be it from our work perspective, that we are working less, we are spending calories less, and we are taking in calories more. So that is leading to this another pandemic which we do not actually recognize. It is a pandemic of obesity. So that thing has to be kept in mind, because when you are bringing obesity home, you are also bringing in various diseases home. Maybe type 2 diabetes, maybe heart disease, maybe high cholesterol, maybe blood pressure high. Then if you have a lot of weight, your knee joints and other joints cannot carry your own body weight. So osteoarthritis is a problem. And of course, people snore more. They make a lot of noise while sleeping, and this is known as obstructive sleep apnea. That means the brain and other tissues are not getting enough oxygen when the patient is sleeping. There is a lot of snoring at that time. So all this actually you are inviting when you are bringing in obesity. Now, you need to understand that who is obese. Things to remember is that European population and Asian populations are slightly different. So the criteria that the Europeans follow may not be sufficient for us. So a person who is labeled as a normal weight person according to European criteria may actually be overweight from Indians' perspective. So that's why I've given this chart. This actually measures BMI. We are all aware of BMI, that is body mass index, how we calculate with weight, and our height that is calculated. You can calculate from anybody's smartphone or on the online. It's very easy to calculate. So what we need to understand is that the BMI cutoffs are slightly lower in Indian or South Asian populations. So we should not be complacent that if according to European criteria we are normal weight, then we are actually normal. That's not so. For Indian population, we have a different set of criteria, and that should be followed to find out whether actually you are falling in the obese category. Now, how COVID-19 and obesity are getting important? The important thing to remember is that there is a strong link between the excess weight and admission to critical care, and also requirement of mechanical ventilation. That means use a ventilator when the patient is ill in the ICU. Let's look at China. It was showing that obesity was associated with 142% higher risk of developing severe pneumonia. If you look at the United Kingdom, there also it was seen that 72% of patients with COVID were overweight or obese, and that among patients with body mass index, that is BMI more than 30, who had undergone ICU care, about 60% of them died. So these things have to be remembered. Again, if you look at the New York City, about 4,000 patients were studied. When the BMI was more than 40, they were extremely obese. This was the second strongest independent predictor of hospitalization after old age. So old age was the most important criteria, and after that obesity became important. Even in the French study, it was saying that admission to ICU was more in obese people. So across the globe, same results were obtained. So this thing has to be remembered, that obesity is a very strong risk factor for problems in COVID-19. Now, how can obesity impact this? This is, of course, subject to research, but it is thought that the high impact of COVID-19 with obesity and severe obesity is probably related to the problematic effects of obesity on the lung function, because we know COVID-19 affects many organs, of which lung is a very important one. And due to the lung problems, many people have to be shifted to ICU and given mechanical ventilation. So maybe this obesity is causing a disturbance in your breathing pattern. So the diaphragm which we have, which separates the abdomen, our chest from the abdomen, and when we breathe in, it goes down, when we breathe out, it goes up and expels the air from the lungs. So maybe here the importance of yoga also comes, that if you have a mindful breathing, if you can do well anulom vilom, etc., so these things can actually have good lung functions. And we advise our patients to do all these things, some respiratory exercises that can help in both when the patient had the infection, for recovery it may be important, and also for those who are apparently healthy, who have not been affected, those people should also do these small things in life. They should put these things in their day-to-day life, so that their diaphragmatic function, their lung function, all the muscles act well, and they do not get affected, touch wood, if they have COVID-19 in the later part of their life. Now, obesity contributes to increase the risk of other diseases as well. So obesity doesn't come alone. Just as I showed in the picture, it brings along with it most of its friends, the very bad friends. That means diabetes, heart failure problems, osteoarthritis problems, all these. So all these actually increase the burden on that particular patient who is having obesity and COVID-19. So the adverse outcome may be more. Now, what do we actually recommend for people with obesity regarding COVID-19? That there is obviously a need for increased vigilance, priority on detection and testing, as well as a proactive therapy policy for patients with obesity and COVID-19. And those who are extremely obese, morbidly obese, where the patient's BMI is more than 40, in those patients, all steps should be taken so that the patient does not catch an infection, because a high level of alert should exist, because if they catch an infection, the chance of getting complications are very high. So the best thing is to avoid the infection. Now, obviously, losing weight, lowering your blood pressure, controlling your blood sugar should be few of the targets which the patient should be given. And also we should remember that very obese people, there is a problem in putting the windpipe when the patient needs mechanical ventilation. The patient needs to be put on ventilator. The critical care specialist or the anesthetist try to put in the pipe in their airway. That's very difficult. This is called difficult to intubate. And also there is difficulty in extubating. When you want to bring out and the patient is doing well, he can breathe on his own. At that time, if you want to take out, then also it becomes difficult, because the tissues are there so much congested, so much fat is there. To introduction of the tube and removal of the tube both become problems. Now I'll just touch over this nutrition aspect. This is very important, because any disease which is infective in origin, you must have good nutrition. Otherwise, how will the body fight that particular pathogen or that enemy? So for that, you need good protein, good calories. Obviously that has to be taken care when the patient is ill, but not only when the patient is ill, even in the normal state, we all should have a healthy diet, a healthy form of carbohydrate, protein and fat ratio to be taken, so that the patient remains in a good nutritional status. Here obviously good nutrition means neither undernutrition, neither overnutrition, because overnutrition is obesity and that is also a disease. Now, vitamins are also important. Like I will talk of vitamin D. Vitamin D's deficiency, we know in today's day, is very much widespread. Maybe due to change in lifestyle, maybe we are remaining indoors a lot of time, maybe we are covering our bodies a lot, maybe there is air pollution, so the rays of light cannot come as they should come on the skin for a particular duration of time. So vitamin D deficiency is definitely, if we test, a lot of people have, and among diabetic patients, let me tell you, vitamin D insufficiency is to a quite higher order. And when vitamin D deficiency is there, the body's capacity to fight, that means your own immunity, your own soldiers cannot fight well. So obviously respiratory infections can hit you very hard. So that thing has to be taken into mind. And lastly, lipids, that means the fats and COVID-19. It has been seen that the triglycerides, which we see in the lipid profile, the various parameters which we check, triglycerides may be raised as a result directly of COVID-19 infection, or due to the various treatments that had been in use recently, also the drugs that were given, that can actually cause alteration in the lipid profile. So that also needs to be taken into account. And often doctors give statin group of drugs, which we know has a very good effect on the heart, cholesterol and other effects. So that thing, if the doctor thinks that your oxidative stress and inflammation needs to be reduced and statins can play a role, then obviously that part has to be followed. And now we come to some other organs before we complete the presentation, is that the pituitary gland, which we are talking about, which is situated inside our brain, in the folds of the brain. So here also we see that when the SARS was there, SARS outbreak, there also it was seen that the patients are having some pituitary issues, because the normal pituitary hormones that are secreted, that are getting impaired or hampered, and as a result of that, the body suffers. In case of COVID-19, both the hypothalamus and our pituitary tissues express certain receptors and could be viral targets. This is obviously subject to research. We still do not have much data on that. Then coming to the thyroid gland, which is situated in the neck, and because we know thyroid has a very extensive role in the body, though data on the thyroid involvement by coronavirus are most scarce, but still we need to be careful, because we see there is alteration in the thyroid function in many patients. Many patients have disturbance in the thyroid hormone secretion. Either there is under secretion or there is over secretion, and that needs changing of the medicines at certain points of time. And the Graves' disease is an important disease in thyroidology, where the gland actually produces more hormones and the patients lose weight. There is palpitation, lose sleep. There is good appetite, but still the patient is losing weight. And there are some other cardiac issues as well associated with that. It is seen that in Graves' disease, COVID-19 can be a factor for either the start of the disease, or the patient was well on medicines or without medicines, there is a relapse, the disease has come back. So these reports are definitely there, we have to take into account. And then almost coming to the end of the organs, like adrenal gland, which I was talking, which is situated over the two kidneys, which produces steroids and keeps us alive. This is very important. So adrenal insufficiency, that means the hormonal secretions from the adrenals are not up to the mark. This is a very important thing, because these patients may actually die if the steroids are not given from outside. So those patients who are actually labeled as adrenal insufficient, they usually continue steroid medicines for a long period of time, even for a lifetime. They have to take that drug. And when there is illness of COVID-19, those sick days, they are called sick days, when the patient is actually sick, the dose needs to be actually increased or enhanced. That part is very important to tide over this crisis period. And lastly, calcium, I would just mention that low calcium may occur in COVID-19 infection. And so evaluation and adequate supplementation in hospitalized patients, especially in hospital setting, we can see that low calcium can create some problems. And androgens means the male hormones, which all the men have. So that also is important for survival. And in COVID-19 infection, there are issues of androgen dysfunction as well. Now coming to the future prospects, because scientists and researchers are working day in and day out to find out if anything can work in this particular setting. Like oxytocin is one of the molecules where they are trying to see what effects they have. Melatonin is another molecule they are investigating. We still do not have much data on that, but obviously at one point of time we can see light at the end of the tunnel. So at the end of the presentation, there should be some take-home messages which we should impart to everybody, that we have to win over COVID. That should be our motto. We have to win this pandemic. So mankind will have to find out ways and devise strategies to beat the virus. So that has to be followed. Those who have been infected, unfortunately, might need post-COVID care in certain percentage of patients. We know that post-COVID is one of the important things, that some patients have recovered, most patients have recovered, but few unfortunate people still have some problems, maybe neurological problems, as my previous Dr. Shetty was mentioning. Those are issues, and there may be some myocarditis, so cardiac effects, some forgetfulness problems, some residual kidney problems. So these post-COVID care is very much important. Some breathlessness is there, so some patients require repeat scans and then some other medicines. So those people who have been affected, post-COVID care becomes one of the important pillars of modern medicine. And certain complications have to be taken care of by consulting with the physician, because you don't know. If you find out anything abnormal inside your system, that this should not have occurred to me, please relay this to your physician that I am facing this. And luckily, those who have not been affected should take utmost precautions so that they do not catch up the virus, and especially the frail and the elderly, because they will suffer more and mortality may be more. And the thing that should be talked at the present moment, when maybe vaccines are coming, the pandemic curve has flattened, which I had shown at the beginning, that people may think, okay, now I can go out without a mask, now I can just go back to normal life, as if I have got azadi from all these things. It's not so. So there should not be any room for complacency just because the curve is showing to be flattened, because we do not know what lies next. So you have to be careful for your own benefit and the benefit of the society. Personal protection and hygiene should be an everyday priority for quite some time henceforth. So obviously, when you are washing your hands, wearing the mask, maintaining physical distancing, this should not be only for the virus. This should be actually for any infection. So this should be ingrained as a good habit for the times coming. We still do not know how long the immunity lasts after recovery from an infection. So though you have a good antibody, you can say, I have recovered from COVID, I had COVID earlier, and now I have recovered from it. So don't think that your immunity will last forever. We still do not know. So till you do not know, you better be careful. So till then, everybody should stick to these three norms of physical distancing, mask wearing, and hand washing. So obviously, physical distancing, by that we all know what needs to be done. I tend to avoid the word social distancing because that tends to impart a different meaning. So physical distancing is more important. And obviously, mask etiquette is very important. Do wear the mask as it should be done, and not just hanging it below your chin or not covering your nose, mouth, everything. It's not, even if it covers your nose and mouth, if it is not a tight fitting one or a snugly fitting one, it may be a problem. So please maintain that. And washing hands, we have discussed enough for all these things. This should be maintained. All corners, nooks and corners of your hand, below your nails, your thumb, the backside, everything should be clean properly. And then only you should touch surfaces. And you should reduce contact with external surfaces, common surfaces, as low as possible. So when you are going to a market, when you're going to a shop, a shopping mall, so try to touch as less as possible. That is the best thing to do. And use hand sanitizers in between. And lastly, I sincerely believe that mankind will emerge stronger and become a more responsible species on this planet in a post-COVID world. Thank you for the patient hearing.
Thank you so much, Dr. Chakravarti. It was indeed a very detailed presentation. But still, I would like to ask you two questions. And the first one is, as you mentioned during the presentation, that if we find 10 people around us, at least one of them might be suffering from diabetes, right? So now there are two types of people who are suffering with diabetes: people who are probably in their 30s or 40s, and people who are in their 60s, 70s, and 80s. Which are all the diabetic patients are at the greater risk of developing COVID-19 disease?
You need to understand that when an infection occurs in the body, there are multiple factors which determine. This is basically a war going on. This is the individual and this is the virus. So virus will try to find out loopholes in the system where it is hurting. Just like if two people are fighting, they need to find out the weakness of the other. Now, a 30 to 40% versus a 60 to 70%. What normally we expect in 60 to 70 aged patients, there are some factors like the patient may have some coexisting heart disease. He may be on 5 to 6 medicines already. His immunity may already be impaired by some other circumstances. So normally, the 60 to 70 aged patient will be at a higher risk than a 30 to 40 aged person. But the problem or the beauty of this virus is that even 20-24 year people are dying, while 70 to 80 aged people are recovering, thankfully. So that's the problem. So that needs two factors: how the virus is behaving and how the individual is behaving. The individual's immunity should be at the highest, because we cannot predict the virus. So maybe you should keep your habits in a fashion that you are staying happy, you are having a healthy diet, your breathing patterns are smooth, you are not stressed out so much. If you have sugars, diabetic, you control that well. So all these factors have to be judged before saying who are actually at greater risk. But grossly, your question's answer will be the old age person has to be at greater safety standards than the younger one.
Right, right. Thank you so much. And the next question I would like to ask you, we are now, we have got the vaccines and vaccination program is going on across the country. So how diabetic patients, probably what should they take the vaccine? Should they not take the vaccine? How vaccine is going to affect these patients?
So we are in the middle of a pandemic. So obviously around the globe, we have seen that there have been emergency authorizations of the vaccine. Usually the vaccine that takes a lot of time to get into the market, the every government everywhere around the world, because it's a huge problem worldwide. So there has been emergency authorizations. That means the thing has been fast forwarded, so that now the population has to be immunized, herd immunity has to be created, because we cannot rely on the virus to create herd immunity. We do
Right.
not know. So the vaccine can be the best one among the two. That means infection wise immunity, vaccine wise immunity. This is number one. Number two, who should take, who should not take. Till now, the guidelines say that it is not mandatory, it is a voluntary. You decide whether you take or not. Now, how do you decide? There may be various factors. A layman, how will that patient decide? So he has to consult with the doctor, because you have seen just last week, both the companies have brought out certain don'ts, do's and don'ts, where not to take the vaccine. If you see that, if you are allergic to that, if you are on a blood thinner, if you had hypersensitivity to one dose, do not take the second dose. So these things have to be taken into consideration before stamping that yes, you go on with the vaccine. Now, when I treat a patient of endocrinology, what do? I see whether there is a co-prescription or not. That means whether the patient is also following the advice of a cardiologist, where there might be a blood thinner. So I say ki from my angle, I see my points. You are eligible to take the vaccine, but please take the clearance of your cardiologist, because if you are on a blood thinner, that becomes a do not for you, contraindication for taking the vaccine. So obviously, if you are in the middle of an illness, if you are having sore throat, you are already going through an infection, so that is for any vaccination you do not take at that moment. Maybe you need that to settle down, and then you go for the vaccine. So these factors have to be taken, but till now it is not mandatory, and you have to consider all these factors. Take clearance from your doctors that whether I am eligible for that particular vaccine or not.
Right. Thank you so much, sir. With these two questions, we would like to end this today's session formally here. And we thank you, Dr. Chakravarti, for taking time out from your busy schedule and conducting the session online. Once again, as I always do, I would like to tell all the viewers, if you have any question, please write to us. We will be happy to connect you with Dr. Chakravarti also from Narayana Health, and you can then take it forward if you have got some specific queries. And you can always visit the complete schedule for the Panacea program on our website, that is panacea.eletsonline.com. We once again thank Beatrice and eHealth magazine who have conceptualized the entire program. This is a 6 month long campaign, and we also thank Narayana Health and Jindal Nature Care Institute, Uttar Pradesh Ayush Society, and Sohini Moksha. These are some of the organizations which have supported us in this journey. So, Dr. Chakravarti, thank you so much, and we would like to formally close the session here.
Thank you. Bye. See you all. Stay happy, stay healthy. Thank you. Bye.
Thank you so much, Dr. Chakravarti.
Bye.
Thank
Bye.
you.